Hallux valgus pathological anatomy is a bit complicated, but it is actually the main factor which is leading to this complex problem. It's not an isolated issue of the first day. First of all, you have to understand what actually happens at the hallux valgus. That is, there are phalanges. Now, this is a metatarsophalangeal joint, first phalanx and the distal phalanx. Now, all first proximal and distal will go laterally, that is away from the midline, while the metatarsal and metatarsal head will go in varus, plantar flexion, and in pronation. This is important to understand because this problem starts with the pull of the adductor hallucis. Now, adductor hallucis starts to pull this proximal phalanx and all the way this goes laterally. Now, when this happens, this extensor hallucis longus tendon is also actually lateralized. When this is lateralized, when it's pulling, its normal pull is through the center of the midline. That is, goes right through both the sesamoid, which are actually present on the plantar aspect of the metatarsal head. But when extensor hallucis longus is also lateralized, this leads to another problem, that is that extensor hallucis longus further aggravates or actually accentuates the pull of the adductor hallucis, and this leads to further problems of more lateralization of the phalanx, more medialization of the metatarsal head as well as the first metatarsal, leading to further hallux valgus problem or further hallux valgus formation. Now, as this progresses, the adductor hallucis, you can appreciate, is also pulling. Now, the extensor hallucis longus tendon is also lateralized, and it will further contribute to the pull and lateralization of the phalanx. Eventually, this whole process, that is the sesamoids, and they all go in lateralized fashion. You can appreciate that this is the metatarsal head, which is most medial structure over here, while all the sesamoids are also been lateralized with the adductor hallucis. Even the abductor hallucis is actually which forms the center line by now time. So overall of this factor, the pull factor results in one thing, that is the phalanges have gone laterally. The metatarsal head goes into a plantar flexion and pronation, with first metatarsal going into the varus, and this leads to the formation of hallux valgus. Head width stays normal, but as the head is going into varus and the flanges are going into the lateral, there is actually uncoverage of the first metatarsal head. And this uncoverage is actually important because the soft tissue formation which occurs over this leads to bunion formation, which is a classically swelling, which is our bunion formation, which is seen in the hallux valgus of the clinically. Now, if you see, this is another diagram which is actually explaining the same mechanism. This is the metatarsal head, this is the medial and the lateral side, and this is the extensor hallucis longus tendon and extensor hallucis brevis tendon. Now, the brevis tendon is taken as the guideline because extensor hallucis longus tendon gets lateralized and further contributes to the pull, and these are the two sesamoids. As you know, that there is abductor hallucis and flexor hallucis brevis muscle, which is the medial their side of it, or medial tendon, and then there is a lateral tendon. Both the sesamoids are actually intratendinous, and they're actually going through the flexor hallucis brevis muscle. Medial and the lateral sesamoid. This is the lateral sesamoid, and this is the medial sesamoid. Now, this is where the problems are. This is adductor hallucis, or ADH. Now, when this will start to pull, now this will not pull the metatarsal head, but it will start to pull the first proximal phalanx, which was seen over here. You can appreciate that adductor hallucis is starting to pulling the first phalanx. When this phalanx goes in laterally in this direction, the head will automatically go medially. And this eventually, once this pull effect has happened, this is what happens. You can appreciate that this was supposed to be the midline. The whole head has gone medialized, while all the bones, the sesamoid and the muscles have actually the lateralized. This leads to hallux valgus formation, or eventually formation of this is called as laterally deviating first toe, or the first tray as well. And this is the pain pathophysiology or pathoanatomy, that it's actually the disturbance of kinematics between the pull of extensor hallucis longus muscle and with the adductor hallucis muscle with abductor hallucis and flexor hallucis brevis muscle, which is actually containing the sesamoids. And all this leads to eventually abnormality of the hallux valgus or the first ray of the big toe.